So the next video is going to be a demonstration of interview and what sort of questions that you might get asked at interview. During this video, we're going to demonstrate wrong answers or not very good answers, and then show you an example of good or better answers. The one thing about interviews is, I cannot stress highly enough, is that you must prepare for the interview. So the first thing that you can do is have a look at our educational file, watch these videos, and also if you need to, you can speak to one of the nurse advisors to help you with your interview technique or with any interview preparation. Also, to prepare, you must investigate and research the job that you're going for. So we can provide you with job descriptions, we can provide you with some information about the hospital, but it is always good to do your own research. So every care home group or every hospital will have their own website. You can go onto the website, you can have a look at friends and family test, which shows you about the response of the service users and whether they think it's a good service or a poor service. And you can also have a look at the care home's values or the trust's values, the hospital's values. The other thing you should look at is have questions about how big is the hospital, what sort of services do they provide. And the other thing that you really should look at before you do the interview is the location. So do you like the location? Will it work for you? And research about local transport links. If you've got children, you can look at schools, childcare, and look at the local amenities to see whether it will be right for you. You will be given a time to attend your interview by your recruitment consultant. It's always a good idea to arrive a little bit early, to come well presented, and to bring your documentation with you. You don't have to wear a suit. It's not absolutely imperative that you wear a suit, but you should be dressed smartly and professionally. We do get some people that turn up to interview in jeans and trainers and hoodies, and the interview teams don't like that. In the UK, interview is quite a formal process, so you should come well prepared, well dressed and on time.
Good morning, Jennie. My name is Ignacio Santos. This is my colleague Luisa and Lisa. So, tell me a bit about yourself. Why do you want to work at this hospital?
So I graduated in 2011. I worked for 2 years, more or less, in a care home in Italy. For the last 2 years, I haven't been employed, so I can't get a job. I want to work in the UK because I need a job, I need money, and I would like to improve my English. So the wrong answer here is that 1, you just need any job, and 2, that you would like to improve your English. This isn't a language school, and also the hospital or the care home want to know that you want to work in that hospital. So now we will demonstrate a good answer. Okay, I feel a little bit nervous, so I do apologise. But my name's Jennie. I graduated in 2011. And for the first 2 years, I worked in a nursing home in Italy, which was an amazing experience for me. It was great to be finally nursing and doing the job that I've always wanted to do. And also, it was really good to establish excellent basic nursing care and get to know the residents really well, and to deliver medication, to do dressings, etc. It's always been my aim to work in the hospital environment, and unfortunately in the last couple of years in Italy the economic situation has meant that it's very difficult to find work now. I always wanted to work in the UK, and I've been practicing my English a lot, and when Ignacio showed me the offer it really interested me, and I undertook some further research. I looked at the hospital, I looked at the friends and family report from the hospital, I looked at the website. I see that it's a good environment to work in, and would be good for my professional development and also my career. So I'd just like to thank you for giving me the opportunity to do the interview today, and I'm really excited about being able to work in the United Kingdom.
Jennie, what qualities do you think a nurse should have, and what are your strongest qualities?
I think a nurse should be knowledgeable, and I can't really think of anything else. Caring. My strongest qualities are that I'm professional. I think I'm caring, and I'm knowledgeable also. So the answer was wrong there because your answer was exactly the same as the answer for the qualities of a nurse. So here you need to think about your best qualities, and this is your opportunity to talk about you as a nurse and about your strongest character. So I always say to the candidates, the best thing to do is to ask your colleagues or your friends or your family what your best qualities are, because nurses or people in general aren't very good at being very positive about themselves. We're always very good at being negative about ourselves, but we're not very good about being positive. So here I would say you can choose 3 qualities that a nurse should be, but change your qualities and apply it to the question. So the next take you will see a good answer for this. I think as a nurse you need to have many different qualities, and different qualities apply to different situations. But the 3 most important qualities for a nurse should be that you're approachable, that you're very caring, and you try to understand how the patients might be feeling when they're in your care, and also that you're professional. I think it's really important that nurses maintain their profession. My strongest qualities, I think I am adaptable. I think that I can work in any given situation. I'm eager to learn. I want to progress my career professionally, and also I'm a very caring, compassionate person. I always wanted to be a nurse from when I was really small, and I think it's a real privileged position to be in. And nurses generally have a lot of care and a lot of compassion to give. So I think nurses have many different qualities, and some nurses have strengths in some areas and some have strengths in others.
If you found you were having difficulties in your clinical area or ward, what would you do?
I would speak to my nurse in charge and I'd ask for help if I needed it. Okay, this is a poor answer because it's a short answer, and you can make your answers bigger by discussing times where you might have found something difficult and give an example of how you overcame that difficulty. The interview team want to know that you're adaptable, they want to know that you'd raise any concerns, and they want to know that you would recognise any limitations within yourself. So in the next take you will see a good or a better answer. Okay, so I understand that moving to the United Kingdom to work in a different environment might be challenging at times, but I've heard that your hospital provides really good mentorship and support. If I was having difficulty in my clinical area, I'd probably talk to my colleagues about it. I'd also talk to my senior nurse and see if there's anything additional that I could explore to help me with that difficulty. So I think it's important as a nurse that you're able to recognise your own limitations and that you take good steps to be able to overcome those difficulties. And I'm not naive to think that there won't be difficulties when I start working in the United Kingdom, but I'm in a position where I think I'm adaptable, like I said before, and I would make sure that I was able to do the job that I was meant to be doing.
How do you help maintain high standards of nursing care on the ward?
I'm not sure I know really what the question means. I guess I would keep myself up to date and act in a way I'm supposed to act. That's it. Okay, so this is a poor answer again because it doesn't go into very much detail and it doesn't recognise all the things that a nurse can do to keep high standards. So high standards are very important that we maintain them, and there are many ways that we can maintain high standards. Okay, well, I think my 4-year degree and then my working experience have given me good skills to be able to maintain high standards. But In terms of maintaining high standards and quality care on the wards, I think that I would have to keep up to date, so constantly reading journals and undertaking professional development courses and mandatory training to make sure that my practice is up to date. I would ensure that I understand the local policies and procedures or guidelines that the hospital might have. I think communication is one of the most important things in healthcare to be able to maintain high standards. Teamwork as well. If you can't work in a team effectively, then standards will fall. I think being a role model is really important, so that you role model for junior staff and for students as well. And one of the most important things is making sure that you listen to your patients, you understand your patient group, and that you continue to strive for improvements. And I understand the NHS has some key drivers and targets that say that we should constantly be assuring high quality and making sure that standards are maintained.
In your opinion, what are the 3 most important things to a patient?
3 most important things to a patient. The cleanliness of the ward, maybe. That I have information about my stay. I can't think of any more. So this is a poor answer again, because you only give 2 things that would be important to a patient. And also it's another short answer. So you need to try and fill your answers and give examples if you need to, or talk about how the patient is an individual, so that every patient might have a different thing that's important to them, and the importance of discussing individual needs with the patient. I think it's important to appreciate that every patient has their own individual ideas on what is important to them. I think overall patients want to be treated with kindness. They want to be treated with respect. And also they might want to be involved in their care or not involved in their care. But again, I think it's important that you don't bracket the 3 most important things, and that you understand that each patient might be slightly different. So, for example, I've cared for patients who want lots of information about their care. They want to know about their treatment really well. And then I've cared for patients who don't like to have all the information, and that they want to trust the healthcare professionals to do a job that's good for them. So I think this question is a good question. I think it's one that you can emphasise a patient's individual needs, and it's really important that as a nurse we understand our patients and what's important for them.
When caring for a group of patients, how do you prioritize your workload?
I don't know really, I just get on with it. I'm a nurse, I know how to organise my day. It's difficult to say how you would prioritise a workload. I look at my patients and decide who needs me first. So this is a poor answer. It's a little bit arrogant almost, in that you assume that you would just know what to do, and it doesn't go into very much detail. So you need to explain about individual patients, about every day is different, about how your workload changes all the time, how as personally or adaptable you can change, etc. I think here you need to recognise that every day is different when you're nursing and working in a hospital environment. So first of all, it's really important to get a good handover from the previous shift, and it's really important that people keep very good records, good documentation, and that information is shared amongst colleagues. On a day-to-day basis, I think nurses are very good at prioritising their workload, and after I'd taken handover, then you would go and see all your patients and decide who has the most pressing problem first, so who is in the most need of your attention first, and also that you balance any tasks that you might have, and you prioritise the ones that are the most important first. I think it's important to recognise that in hospitals, generally you work as teams. So if you needed to have help, you'd ask for help. If you needed to delegate some responsibilities to either a junior member of staff or a student nurse or a healthcare worker, then you can do that responsibly, delegate appropriate tasks to appropriate people. I think that you would document throughout your shift so that you don't wait to the end of the day for you to complete your documentation, and that you complete tasks as they arrive and when they arrive. Prioritisation is a skill, I think, and it's one that you develop as your career progresses and you get better at. But I think prioritisation is tackling every day what you have in front of you and making sure you deal with the most important problems first.
Infection control is a high priority. How do you reduce the risk of infection?
Wear gloves, wash my hands, teach patients how to be clean, those kind of things. Okay, again, this is a poor answer because it's short and it doesn't go into much detail. So you need to try and fill your answers with more content and also not be so laid back in the answers. Okay, infection control obviously is a huge problem throughout all hospitals, whichever country you work in. I think obviously the most basic things that you can do are good hand washing before and after touching a patient, wearing gloves and protective personal equipment when you need to, so aprons, masks, and things like that when you're doing patient care. If a patient has an infection such as Clostridium difficile or MRSA, that you would isolate those patients and treat them accordingly. You would educate the patient, so you teach them how to protect themselves and to use good hand washing, etc., and good hygiene. You'd educate visitors so that they have to wash their hands when they come in. When I was a student, I worked in an orthopaedic environment where people came in for elective orthopaedic operations, and in pre-assessment, they used to be screened for MRSA before, so they'd be tested to see if they have colonised MRSA, and then you would treat them before they had the operation. Other things like using an aseptic technique when you access invasive devices, using an aseptic technique when you do wound dressings, educating the doctors, so making sure that they are bare below the elbows, washing uniforms. There are many, many things that we can do to improve infection control rates in hospital.
A patient on your ward starts complaining of chest pain. In that case, what would you do?
I guess it's my responsibility to take care of the patient and to follow doctor's orders, to do what I have to do for that patient, talk to them. Just usual nursing care, really. Okay, so this answer is poor, again, because there isn't much detail. It doesn't talk about individualised care. It doesn't recognise that the patient is at the centre of everything. So again, you can see a more improved answer and you can see the difference. Okay, first of all, I would talk to the patient. So I would assess the patient. I would use the ABCDE means of assessment. So first of all, check the airway, make sure there's no obstruction, make sure the patient is responding to me. Then I would assess the breathing. So I would look at the respiratory rates, oxygen levels, whether they're using any accessory muscles. I would put oxygen on. Circulation, I would check the pulse, see if it's regular or irregular, see if it's bounding or thready. I would check the blood pressure. I would do an ECG because the patient's having chest pain, could be cardiac related. I would check that the patient has intravenous access and give any pain relief if they're prescribed pain relief. Disability, I would check the patient's conscious level, perhaps check her blood sugar. Exposure, I would check the patient's notes and make sure that I understood the patient's condition. Have they suffered with chest pain before? Do they have any cardiac issues? Check the drug chart again. I would do a top-to-toe assessment, see if there's any visible signs of any injury or anything else. I would call the doctor. I would stay with the patient and keep a pain score, so assess if their level of pain is reducing. And I would document everything in the notes. And most of all, I would talk to the patient and reassure them and not leave them until the doctor has arrived and assessed the patient.
A frail elderly patient with dementia is admitted with increased confusion. What are your responsibilities?
Oh, that's a difficult one. Medication. Okay, well, I would tell the doctor and tell my senior nurse that I made a mistake. I think that's what I would do. So this answer again isn't in much detail, doesn't talk about the patient, doesn't talk about documentation, doesn't talk about recognising your own mistakes. So again, with this answer, you need to be more specific about exactly what you would do. Okay, so first of all, I need to find out about the deterioration and the presenting problem. So I need to assess the medical notes and the assessment that was done initially by the doctor, and also look in past medical notes to see if this is an exacerbation of the dementia or what is happening. I think it's really important that I would introduce myself, I would orientate the patient to the ward, explain any interventions or procedures very well to the patient so that they understand as best as they can. As per the NMC Code of Professional Conduct tells us that we should be an advocate for the patient, so that I think that's really important in this situation because the patient might have a lack of capacity. So we need to make sure that everything is in the patient's best interest, that it's well documented, that it's discussed with family. I think it's important that you assess the environment so that you check that it's safe for the patient. For example, if the patient is wandering around and trying to get out of the ward, then you'd make sure that someone is supervising the patient at all times. And this is an exacerbation of confusion, so we'd need to investigate why. Is it worsening dementia? Is there a reason for the confusion? Has the patient got a urine infection or a chest infection? So we'd screen the patient for any infection, make sure that bloods have been taken and check to see if there's any abnormalities in the blood results. I think keep the family informed at all times, and I think the most important thing is to make the patient feel secure, not stressed, and happy, so that you spend a lot of time talking and explaining to the patient and making sure that they're calm and they know what's happening as best as possible.
You make a medication error. What would you do?
Oh, that's a difficult one. Medication. Okay, well, I would tell the doctor and tell my senior nurse that I made a mistake. I think that's what I would do. So this answer again isn't in much detail, doesn't talk about the patient, doesn't talk about documentation, doesn't talk about recognising your own mistakes. So again, with this answer, you need to be more specific about exactly what you would do. Okay, as per the NMC Code of Professional Conduct, it tells us that we should be open and honest with our patient, and this also fits in with the 6 C's, I believe. So I would have the courage to be open and honest with the patient and tell them that I'd made a mistake. and I would apologise for the mistake. Then I would have to look at how the medication error might affect the patient. Is it a simple error, like maybe I've given paracetamol too much, or is it an error that the patient would need to be monitored by? So I'd have to assess any effects that the patient might have of the error. Then I'd tell the doctor and ask the doctor to come and review. I would speak to my senior nurse and tell them that I'd made a mistake. I would document everything in the notes, and I believe in England you have something called incident reporting, so I'd report the incident officially. I think it's important also not just to think about the actual error, but to look as to why you might have made the error. And from experience, I know that errors can happen because there's a chain of events, or perhaps it was something that I had done that I needed to look at inside myself and see if there was an issue with my medication assessment. Obviously, it's something that you would never want to happen, but everybody's human and sometimes people do make mistakes. And then I would monitor the patient, so depending on the error would depend on how often you'd need to monitor the patient. But I think the most important thing is to be honest about it and not try and hide it from the patient or from my superiors.
A relative approaches you angrily, complaining about their mother's care. What would you do?
Well, I guess I have to find out what's wrong, and I would try and talk to the relative and try and explain what's happened, and maybe ask the senior nurse to speak to them. That's what I do. Okay, so again, this question is halfway there, but it needs more substance to the answer. You need to consider what is wrong with the patient, if you need to put anything right. You need to consider moving away from the clinical area, etc., and give more substance again to your answer. Okay, so if someone's angry and they're shouting, the first thing I do is move them out of the clinical area so that other patients or staff or relatives didn't hear what was happening. So I'd move somewhere private if it was safe, as long as the relative wasn't being really, really aggressive. I'd try and find out what the problem was and talk to them about the problem and apologise if there was any issue. And try and put the situation right. So maybe it's that the patient's been waiting a long time for an X-ray, or maybe the mother hasn't had their dinner, or maybe there's a reason as to why something has happened. So I would investigate and try and put the situation right. I think you have to be clear, you have to have good communication, and if I felt at all there was any threat or I needed help, I would ask for help from my senior nurse. Sometimes it might be good to have another member of staff with you so that you can try and calm the situation down. What else? I would document everything in the notes to make sure there's a clear record, and hopefully just by listening and using clear communication you can resolve the issue. If the issue is not resolved, then perhaps the doctor or the more senior nurse also needs to speak to the relative, and I believe most hospitals have a complaints procedure, so if it wasn't resolved then you would direct the relative to look at the complaints procedure.
We have now reached the end of the interview. Do you have any questions for us?
No, I don't think I have any questions. Thank you. Okay, so this question is really important because if you answer the question as no, because you just want to get out of the interview room, it makes you look like you're quite uninterested. So always prepare a question that you can ask the interview team at the end, and it can be anything. It can be something like, where is my accommodation? How will you support me during the first few months? How do you think my interview went? Is quite a good question to ask. If there's anything that you had forgotten to say during the interview, then you can add it in at this point. But the main point is just to show that you are interested in a question and you're interested in the job, and that you just don't want to run out of the room as quick as possible once the interview is finished. Yes, I do. I have a few. Is that okay? First of all, how is the induction package at the hospital? How much support will I get in the first few months? The second question I'd like to ask you is, where can you see me working? Which department could you see me working in? I just want to say that obviously I've done some care of the elderly when I worked in a nursing home. I'd be happy to work in any environment, but if there's a possibility for me to concentrate in cardiac or cardiology, then that would be really good for me. And the third question is about accommodation. Is there accommodation on site?
Thank you very much for the interview. We will let you know in a few minutes the result of your interview. I think so, definitely yes.
I think so.
Thank you, Jenny. That's the end of the interview. That was not that bad.
This is going to be about half an hour long.